Ozarks.
Elective surgery patients will no longer need to get COVID testing performed before procedures. The governor and Dr. Jose Romero say the positivity rates were so low, it's just no longer necessary. 5 News reporter Nick Camper live and spoke with one doctor about this new update. Nick?
Yeah, back in May when the directive was issued, doctors were saying this was going to be a scheduling nightmare. But 2 months later, the data is showing that the requirement is no longer needed.
Personally, every patient that I've taken to the OR for an elective procedure, the pre-op screening for COVID has been negative.
The governor says data is showing that the positivity rate amongst elective surgery patients is far below 1%.
From what we have statewide, that is very minuscule.
He says resources can now be used elsewhere. The governor says the system was getting clogged and it has proven to be unnecessary. Dr. Kevin LOLLAR with ears, nose, and throat of the OZARKS says his clinic has 5 surgeons, and since March, they have had only a handful of positive cases out of hundreds of patients. He says they operate out of 3 different surgery centers, and with testing spots all over Northwest Arkansas, procedures were having to be canceled because of the dysfunction.
That was, quite the hassle because, again, most of them were negative.
Dr. LOLLAR says he agreed with the decision in May because COVID was so new. But now he's happy it's up to the doctors and clinics because they know their patients best. He says with that, pre-operation screenings pretty much take care of anyone who might be positive.
Have you had a fever? Have you had a cough? Have you had changes in your sense of smell? Those are pretty good at picking up most patients.
Dr. LOLLAR says because he operates in the nose and the sinus area, many of his patients are still going to need to get tested just to ensure their safety. In Fayetteville, covering news where you live, Nick Camper, 5 News.